Hello! In this video, I will be talking about fatigue during breast cancer and its treatment. Before I go on, I'd love to invite you, if you haven't already, to subscribe to our channel. And also, if you want to find out if what I'm going to say next applies to you, you can go to yerbba.com to get your personalized report. So how do we define fatigue? What are the effects of fatigue? What causes fatigue? And what can you do about it? Fatigue is different from tiredness, and it's distinct from weakness. Fatigue is an overwhelming sense of weariness, if you will, and it's not relieved by sleep. So many of us have been tired and we take a nap or we have a good night's sleep and our tiredness gets better. Fatigue related to cancer and its treatment is a little different. No matter how much rest you get, you are still exhausted. And that can give you a sense of not being able to get up and go. You might find yourself in bed much more than you used to be before treatment started, etc. So cancer-specific fatigue or cancer-related fatigue is a phenomenon specific to cancer, and it's thought to be an inflammatory phenomenon related to both cancer and its treatment. I'll get to more of that in a moment. But I do want to validate that if you've had fatigue or if you're about to start treatment, that this can have a tremendous impact on your quality of life. And it's not just as simple as having a good night's rest. As I mentioned, other people around you, unless they have been through cancer treatment, will not understand what you're going through. If you happen to be watching this because someone you love is going through breast cancer treatment, I really want to underscore that this is a phenomenon, a symptom that many of us don't understand. It's even different from the fatigue of mononucleosis. So the impact of fatigue can be tremendous. It affects what we can get done during a day, and that can make our self-esteem fall if we're used to being people always on the go and getting stuff done. It can affect our social life because we don't feel like going out and doing things that we used to, so we can get a little more isolated. It can really lead to, in some people, to a sense of shame, that there's something wrong with me. And that's actually not the case. And that's why I've spent so much time already in this video talking about the fact that this is very different from just tiredness or overexertion. What causes cancer-related fatigue? First, I'll go through the treatments that can do it, and then I'll talk about what we think may be causing the fatigue from those treatments. So surgery alone causes fatigue. After surgery, your body is healing. And even if you don't see the effects, it looks like you're healing just fine, your body's working very hard to heal. I had a friend who had an ankle fracture and had to have surgery and was surprised that during his time of recuperation, he couldn't do the things he had hoped to do during his 6 weeks away from work. There's a fatigue that comes with the healing. For people who have surgery, you will often be told you can go back to work or resume your normal activities after 10 days. And I actually have found that recommending 3 weeks or even longer, if people can take that time, is very helpful before returning to work or their other activities. And that if you're going to start back at work after breast cancer surgery, to go back midweek so that your first week back isn't 5 days, but rather going back on a Wednesday. If you work a Monday through Friday job, you actually have a 3-day week. And my patients have told me that this has been very helpful to them, that they're not sure how they would have gotten through a 5-work-day week. So surgery can cause fatigue, and that's relatively time limited. Radiation therapy can cause fatigue. It's surprising that even being radiated to a small area of the body can cause fatigue. And the thought is that your blood is circulating through that radiated area. So if it's your breast and regional or neighboring lymph nodes, that your blood is going through the radiated field and is thus a systemic effect on your cellular components that lead to fatigue, the response that your body will have, in addition to the skin changes and other changes that we've talked about in our other videos. Chemotherapy is most notorious for causing fatigue. Chemotherapy fatigue tends to build up over time. So with your first cycle, you'll have some fatigue. With your second cycle, more. If you're having 6 cycles, it will be even more after the 6th cycle. This is normal, and it's due to a lot of different things related to chemotherapy. It can be if you're getting chemotherapy and you have disease still in your body, like chemo before surgery, or if you have advanced disease and there's cancer throughout your body, as the cells die, they release a whole bunch of things that your body's then busy cleaning up. So some people have found that comforting to know the fatigue is actually because the cancer is dying. If you've already had surgery and there's no evidence of disease elsewhere in your body, chemotherapy itself, just the chemo alone, can cause the symptom of fatigue. Other things related to chemotherapy can also cause fatigue. So the medications that we use to prevent side effects can cause fatigue. Sleep disturbances are certainly not going to help, even though fatigue doesn't get better with sleep. Of course, sleep disturbances are going to make it even worse. If you are having symptoms such as pain, or some people don't want to call it pain, they're having discomfort, that can make it really hard. And then the medications we use to treat pain after surgery, during chemotherapy, during radiation therapy, can also cause you to have fatigue. The side effects, the medications we use to prevent side effects, even when we're done with chemotherapy, like neuropathy, those can cause a lot of fatigue. So it's important to understand that it's not just the chemotherapy, it's all the other effects of the chemotherapy. But even if you have no side effects from the chemotherapy itself, you're sleeping just fine, your appetite's good, you're not on pain medicine, just the chemotherapy itself can cause fatigue. Endocrine therapy or hormonal therapy can cause fatigue if you're having hot flashes and side effects that disturb your sleep. Those things can obviously cause worsening fatigue over and above the treatment you've already received, especially if you're getting hormonal therapy after radiation and after chemotherapy. You can see these things build up. Targeted therapy can also cause fatigue, especially if you have disease in your body that we're killing with treatment. Again, all those things being released in your body can cause fatigue. I'd like to talk about how long the fatigue lasts with each treatment. With surgery, as I mentioned, it tends to be time limited. So if your only treatment is surgery, I would say by 6 weeks, that your fatigue should be completely resolved. But of course, if you're getting radiation therapy and chemotherapy, it's going to last longer, and at that point it won't be from surgery, it will be from the other treatments. The fatigue following radiation therapy tends to last about 6 weeks to 2 months. There can be people who have fatigue for longer. With chemotherapy, I actually tell people to expect 6 to 12 months before their energy level is back. Now, it won't be the case that you feel exhausted that entire time. Rather, you'll notice some improvements, week over week and month over month, and that if you're not feeling your energies back at 6 months, don't give up. You may see a marked improvement at 12 months. Again, you may not notice this day after day, but you will notice it when you go back to see your medical team, for example, and you look back, and let's say your fatigue was at an 8 out of 10 at the end of therapy, and you go back at 6 months, it might be at a 4, and then a year, it might be 1 or 2. Now, there are some people who have persistent fatigue. About 5% of people, or 1 in 20 people, will have persistent long-term fatigue related to their cancer treatment. We do not know who those folks will be ahead of time. We're working on it. We're trying to understand who's at risk for long-term fatigue so that when we make treatment recommendations, we can say, in your case, you are more likely to have long-term fatigue, and given the potential benefit of chemotherapy and the potential for that side effect, the risk-benefit ratio in your case doesn't really warrant getting chemotherapy. At this point, though, we recommend chemotherapy in people where we expect to see a decrease in the risk of recurrence and death from breast cancer, and we just inform you about these possible side effects. So I've covered a lot. If you want to learn more about the treatment options you might hear about that I've just covered, visit yerbba.com for your personalized report. Next, I'm going to talk about what can you do to improve fatigue related to cancer and its treatment. I want to remind you that we think that the fatigue from cancer is an inflammatory response. One of the things we know is that movement, if you want to call it exercise, is actually anti-inflammatory. Even though we might get sore joints or sore muscles, or if we're trying something new, we might ache all over, believe it or not, your body is making anti-inflammatory molecules through movement and through exercise. So I know it sounds really counterintuitive when you're fatigued to say, get out and move. But honestly, this is, of all the things we know, probably the best thing for you. And if you're watching this on behalf of somebody going through cancer treatment, you can encourage people to get some movement, even if you just start with 5 minutes a day, or you can do 5 minutes 3 times a day. But please don't bully the person you love into movement, because they need to be inspired to do this themselves. They can watch this video. And movement can be yoga, it can be walking. It does not need to be at the gym, on a treadmill or an elliptical, or running or rowing. You just want to start small. Now, one thing I will say is my people who notice fatigue the most are the people who were very active before treatment. So people who are very low energy before chemotherapy often don't notice a difference. It's the people who are go-go, always able to do more than other people in their friend circle or in their family. They're sort of the doers in their family. You're the ones who are going to notice fatigue more than if you tend to be somebody who is more sedentary. So you already know the benefits of activity. If you are affected and you've had activity before, I know I'm sort of preaching to the choir, but I would say try to tap into some movement that you enjoyed. The other thing to do is to make sure to get natural light for part of every day. Even I have all the lights on in my room right now as I'm recording this, but even with all those lights on, there's more light, natural light, if I go outside, even if it's a cloudy day. So even if you don't want to go out and move, just get some natural light. There's a gland at the base of the brain called the pineal gland, and that regulates our circadian rhythms when we wake and when we sleep. And that gland is also stimulated by natural light, and that can really help with fatigue. It can also help you sleep better, which is something you really need. I'm going to talk next about rest. So I mentioned that cancer-related fatigue does not get better with rest, but I will tell you that making sure you get enough rest is really fundamental if you're combating fatigue. So try to get a good night's sleep. If you tend to be a night owl, that's okay. Just make sure you can sleep in the morning. If you've never been good about a bedtime routine, this is a great time to have one. Ways that can help you sleep better are to sleep in a cool room. If you're having problems with hot flashes or night sweats, you can watch our other video, but just briefly, wearing cotton, not wearing nylon or synthetic fabrics can help with hot flashes at night. You can run a little fan by your bedside. You can have a small amount of very cold ice water. At bedtime, you don't want to have too much because you don't want to be up all night peeing. But if you have a glass of, what I have my patients do is take a plastic cup, fill it with about 4 to 6 ounces of water, put it in the freezer, and then you can take it out and it's super chilled. And as you're getting ready for bed, you can just sip on that very, very cold water. That really helps regulate your temperature at night. If you decide to take a nap, we recommend that you take short naps. Even though you could probably sleep the whole day away, that will mess up your circadian rhythms. So what I recommend is you limit your naps to 20 to 40 minutes. And if you want to plan something on the other side that helps you get up, that can be really useful. I never used to be able to nap, but now I'm a queen napper, and I can sleep for 2 hours in the middle of the afternoon. If it's a rainy day or a gray day, I can take a long nap, but that's not the right duration. So this is one of those do what I say, not what I do. Just try to limit your naps to 20 to 40 minutes. We call those power naps. What that will do is help protect your night sleep so you can go into a deeper sleep at night. Other things I recommend you do is avoid alcohol. Alcohol is a depressant. Other drugs that are depressants are also to be avoided, as are stimulants. So if you're a smoker, I would say try to stop smoking, because the products in cigarettes are stimulants, and while they may make you feel really alert in the short term, they can mess up your sleep in the on the daily. So just really be careful with what you're putting in your body. Make sure you're eating a healthful diet, lots of colorful foods. So dark greens and dark blues like blueberries, fruit, those sorts of things can give you fuel to help with fatigue. You'll want to avoid things that are very heavy and starchy, cream sauces, really rich pasta dishes. I would recommend that you avoid. We know that fruits and vegetables have anti-inflammatory products. We do recommend that you don't get these anti-inflammatory things in supplements, because those are high concentrations. They're not natural. They're highly processed. We don't know what's in many of them. They're not regulated. So they sometimes have nothing that they say they have on the packaging, or have lots of fillers. So I recommend that, except for vitamin D, you avoid supplements. A multivitamin's probably safe, but it's probably better to get your nutrients, your micronutrients, from food, the way things were intended to be. There are a few other things that have been tested but are difficult to test, but they certainly do no harm. One is acupuncture. Acupuncture has helped some of my patients, and it's really hard to do clinical trials of acupuncture. The other thing that can really help is yoga. It can help you connect with your body, and there is some evidence that yoga is effective in treating cancer-related fatigue. The other thing you can do, and the last thing I'll mention, is you can break your day up into segments. Instead of getting up in the morning and saying, I have to do all of these things today, you can break things into, this is what I'm going to do between now and 10 a.m. or between now and noon, or this is what I'm going to be doing before bed, and try to keep those things really low stress. Journaling can help, because you can dump out all your thoughts. I recommend that people write in a journal well before bedtime, so you don't get your mind spinning, but close enough to bedtime you can do that dump of all the things that might be keeping you frustrated and scared and worried, because certainly those sorts of things can affect your energy levels. I've covered a lot in this video. I hope it's been helpful to you. Don't forget to subscribe. And if you click like, that helps other people find this video, people who are going through the same things that you're going through. You can follow us on Instagram and keep coming back. We put out 3 videos a week. So I look forward to seeing you back here. As always, you can drop your comments or questions below. We get back to you within a couple weeks at the most, and let us know what's helped you with your energy levels.